Hello, everyone, and welcome to RevitalyzeMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hi, guys. My name is Farideh Golombieski, and I'm a family nurse practitioner, and I'm usually on this podcast with Dr. Durst, talking about all things wellness and aesthetics.
We got lots to cover. Well, we, as you notice, are not in the studio today, and we're in the office, and so this is the office. So welcome to the office if you haven't seen pictures. And
it looks better even in person. Come visit us.
It does. It does, definitely. It doesn't, the pictures and video don't do it justice. So we're going to talk about hormone replacement therapy and men. And again, we do bioidentical hormone replacement therapy. But again, even once we're treating, sometimes they'll get side effects. And so we want to give our patients a source where they can go and listen specifically to side effects because they hear this conversation all day long. They see it in written form and we go over it fast. So this is always another source that they can go back and refer to or refer their friends to.
Exactly.
To get the information. So the main hormone in men, as we know, testosterone.
And when we're talking about side effects, we have to look at what does testosterone convert into, right? So testosterone converts to estrogen. And for men, estrogen is the evil hormone, right? Because too much of it or too little of it usually has some not so great side effects. And they tend to resemble each other a little bit. So too much estrogen in men can cause you to feel emotional. It can cause nipple tenderness. It can cause some negative sexual side effects. It also can cause some bloating and water retention. So those are things we definitely want to watch. On the other hand, really low estrogen can cause issues with sexual function as well. We tend to see more negative side effects with high estrogen, but high is kind of like a relative term. We talk about this a lot in the office. You have your parameters, then we have optimal levels. But with estrogen levels with men, sometimes you can be on the higher end. As long as you're not symptomatic, we can manage that through supplementation. So not necessarily needing to block or prevent that conversion. Sometimes it's just if there are no side effects, we just kind of monitor.
Well, and there's so many different schools of thought on that. And again, I don't know that there's any right way, but I guess the right way is to just have it individualized. And so it depends on the patient. It depends on what level feels good for them. You know, if you prevent it too much and you hit on all the side effects perfectly, again, high levels, like estrogen needs to be present in a man too, and it's protected bone, brain, and heart as well. That's why they have it circulating just at a lower level than women, just like women have testosterone, but a lower level than men. So you want to balance between the two. You have a natural balance between the two. So if we go supplementing or optimizing testosterone, but we block the conversion, then maybe that natural ratio for that patient is being manipulated as well.
Exactly.
And so it's almost like, let's see
how we do.
And then if we need to, we can. The big issue is, right, if you're going to convert to estrogen, if you have a little breast tenderness, that's probably a conversation you need to have because if you get enlargement, then that is harder to treat than actual tenderness that we can treat.
Riding down the road with your buddy and a country song comes on and you start crying. It's probably time to call the office. We need to have a conversation about your estrogen levels.
Correct. It's emotions. Yes. If you start to get, and men will say that and they, and they laugh about that. But again, if it goes on for too long or if you get breast tenderness, that's harder to treat. And that conversion, some people don't feel good on the medication. So,
sometimes what we may think is a normal level might be too low for that patient.
It's all individualized. So again, I think there's a natural ratio for a patient. Manipulating it may or may not be helpful. And so just having those conversations and figuring out what's right for you is important.
Absolutely.
So any breast tenderness, enlargement, emotions, water retention, or you just don't feel good.
Yes.
Those are things we need to know because sometimes it can be, it's either too high or too low for you. Or sometimes, the medication can cause that too. Like if somebody was on medications that blocked and they came to us, I will just say that ultimately, if we're going to add a blocker, we tend to do it either in the pellet or compounded in the injection. Yes. So that when your test is highest, your anastrozole is as well. But that is, an individual choice that we think is right. So,
which we think is best for our patients, and just what we see result wise, we seem to have more consistency for our patients that way. So,
and then the other conversion that you would get, so when you give testosterone, you want it to stay testosterone, but it can convert to estrogen, which again, in women is not an issue, but men is, and that's what we just discussed, or it can convert to DHT, dihydrotestosterone, which is a metabolite that is quite a bit stronger.
Yes. So we don't want to diminish it, right? That makes you feel good. It's 10 times more anabolic. We definitely want to keep some of it, but too much of it, we can see some negative side effects. We may see some acne changes. We may see some hair changes. So definitely we want to keep an eye on those levels, and there are options for treating that as well.
That's right. So we can go to natural supplements to prevent conversions, and we can also go a little bit stronger, or we can actually just block receptor effects of dihydrotestosterone if we want to. So there's lots of different options. Again, just kind of knowing if you're having any of those effects. Usually hair growth is not an issue for men.
Yeah.
Hair thinning would be, and then acne would be, and then also lower urinary tract symptoms. So if you're having frequency, urgency, all of those, hesitancy, then those are things we need to know about too, because that's a DHT effect.
Absolutely. So, and sometimes if estrogen gets high, we'll see those kind of side effects with estrogen too. So pretty much, face it, guys, you have estrogen like me and like Dr. Durst, you just don't need as much of it. So
that's right. Lower level, but needs to be present for prevention. And again, all of them are preventative. And so pretty much we're looking at testosterone primarily, and then controlling those metabolites and conversions. And so again, pellets, I will just put a plug out there for pellets. Once again, I think that those are the best ways to get men and women feeling better, because it goes up and it stays up. So you get less of that up and down in conversion with it. And so less in the way of side effects.
Yeah. And we talk about that a lot in other podcasts. Every time your testosterone peaks, that's when we see these conversions. So trying to minimize those peaks is your best option to prevent.
Yes,
So,
absolutely. And I think men are a lot
blood
easier.
Count. So we got to watch blood counts.
Yeah.
That'd be the other one. There's really kind of like three main things we watch, and that's the other one, is that we get a baseline. When you come in, we get a baseline on your hemoglobin and hematocrit. So testosterone can interact and cause you to create more red blood cells. Not in everybody, just some. So we get a baseline, and we watch that. Again, with less spikes, like with pellets, we see less conversion than we do with injections. But we definitely keep an eye on that. And then those are, if that occurs, there's easy ways to fix that as well.
Yes. And then PSA. Yes, we had bypassed like half of the issues we needed to discuss. So yes, PSA is another one, which is, that prostate marker for cancers. And again, testosterone treatment doesn't cause prostate cancer, but it can cause a cancer there to grow if it's present already. So again, those preventative screening tests by your primary doctor, we monitor a PSA to look for any changes and rate of change of PSA.
Which is so important. Rate of change is a big one.
It's a big one. And we'll do another podcast where we can just talk about prostate cancer and testosterone and the myths therein. Lies a lot of information just in and of itself. So, but again, the rate of change, the PSA level, and just making sure that that doesn't become an alarming issue, because if it does, then you need a urologic consultation and evaluation.
Absolutely. So, as much as you guys hate giving blood, sometimes we just need to check your blood levels, and that can give us a lot of information about what's going on. Just because you're having some of those symptoms doesn't necessarily mean you need to have your blood levels tested. A lot of times these side effects are easily solved just through conversation. We see guys that are on hormone replacement that have experienced a lot of this. So just through practice, we hear it and we know how to fix it. So you don't necessarily have to give a blood sample. I know sometimes that's a deterrent to call the office, is I didn't want to come and give blood. I didn't want to give a blood draw. So just call. A lot of the fixes can be pretty easy just from a conversation. Yeah, no, conversation and tweaking is definitely the first approach, and it doesn't always require blood test and spot blood test, because a lot of times we can make those determinations just based on the conversation. So just having communication with the office,
and letting us know what you're experiencing so that we can address it, because there's multiple different ways to address it.
Absolutely. Probably the last one would be that I can think of would be fertility changes. So on testosterone replacement. So for our younger guys that are looking, and some of our older guys that are looking to, that want to maintain fertility. So testosterone, we definitely have to talk about how testosterone can decrease sperm count. So that is definitely a conversation we have with each patient. We talk about the risks and benefits, and kind of how we can combat that. I feel like for every side effect, there's always a way to combat it one way or another. That is another one that there are some other medical options for, but I think it's very important to note, especially in some of our younger patients, that it can cause decreased sperm. It should not be used as birth control by any means. Any means.
You don't want to trust that.
Exactly.
But again, and so it can decrease sperm count. It could potentially shut down your own system. So if we can get you on something that actually continues your production of testosterone, then your fertility can be maintained. And again, it's having those conversations about whether that is something that is important to you.
Exactly.
And then we need to address it. And then also testicular size, because you always then prompt another one. So
exactly.
Testicular size can be a concern of men. And so if on testosterone treatment you have lower sperm production, then you're also going to just think about, the size of the testicles will decrease. They're not as active. And so you might get a shrinkage of testicular size, which bothers some.
Scrotal atrophy. Yeah. It doesn't hurt you. It's totally fine, but it does bother some. So there are answers for that as well.
Yeah,
to fluff the boys back out.
Fluff the boys back up. Definitely tends to be, I think, an issue just with some, and definitely more of an issue probably with men thinking about it than women.
Women don't care, guys. We don't care.
Yeah, they don't care. But it does matter to men sometimes. And again, we're always our hardest critics, right?
Of course.
So if we notice little changes, we want those corrected. So I think that's about everything. If there's something else that you've experienced with testosterone you'd like to share, we would love to hear about it. If there's anything else you want us to cover, then let us know. Like, subscribe, hit the bell. And again, thank you for once again helping get the word out, spread information, inform our patients. But we're here to talk about anything about wellness, aesthetics, or sexual medicine, and we're here to revitalize your look, your health, and your
sex life.